Hello, so I'm Dr. Malesko and the heart is essential. So we are going to do a quick review, highlights, and what you need to know. So let's get started. So as you see here in the image, you see red blood cells flowing through vessels, and the vessels really are directed by the heart, which pumps the blood. So let's get started with understanding the heart. So the heart, these are the great vessels. We have the superior inferior vena cava. So the inferior vena cava is a systemic vein that is delivering deoxygenated blood, meaning the byproducts from the cells, the CO2 that has built up inside the cells. The systemic veins are bringing that deoxygenated blood back, and all of those veins eventually feed into the main line, which is the inferior vena cava, coming from the lower extremity, pelvis, trunk, all the way to the back, posteriorly in the back of the right side of the heart. So that's the inferior vena cava. So let me annotate that, inferior vena cava. All right, then we have this guy over here. This is the superior vena cava. Superior vena cava. And so this is bringing, again, a systemic vein bringing deoxygenated blood that's coming from the brain, with all the different veins that we're draining the blood that has low oxygen and other waste products that are pretty much going to be delivered back. So we're delivering back deoxygenated blood from the head, the neck, and the superior limb, all again into the right side of the heart. We can divide the heart into, actually I should clear that. It really should be here, because this is the right auricle, because it looks like an ear, and this is the left auricle, and inside the auricle is an atrium. So that's called the right atrium, or the right sided chamber, right atrium. And then there's another chamber called the ventricle. So there's a right ventricle inside here. This is the left atrium, and therefore in here is the left ventricle. All right, so this whole right side of the heart is going to be deoxygenated blood getting pumped in and out. How is it getting out of there? Out of the right ventricle into this great vessel called the pulmonary trunk. All right. Trying to be short and sweet, so I'm not writing it all out. Hopefully you've studied a little bit and you know what I'm talking about, pulmonary trunk. And then the pulmonary trunk divides into a left and a right pulmonary artery. And note that this is systemic circulation versus pulmonary circulation, right? So therefore, in pulmonary circulation, everything is opposite. The artery is moving blood away from the heart, and it's deoxygenated blood going to the lungs. Whereas the artery in systemic circulation moves oxygenated blood away from the heart throughout the rest of the body, which would be this vessel here called the aortic arch, which feeds into the aorta. And the aorta is segmented. It's the main pipeline bringing oxygenated blood to all its tributaries. Think of it as a main highway. And when it's in the chest, it's called the thoracic aorta. When it gets to the abdomen, it's the abdominal aorta. And then it splits into the common iliac, and then further and further into tributaries, femoral artery, and all the little branches that eventually get to the foot with dorsalis pedis, posterior tibial, and peroneal arteries. So obviously, you've got to get all that oxygenated blood from this left side of the heart down to your little toes. And you can thank your aortic arch and aorta for that, and your left ventricle for being powerful and pumping that blood throughout the rest of the body, and that systemic circulation. All right, so if we look at this heart, the apex is going to face the patient's left hand. So I'm going to try to draw up. It's a really bad picture. I'm not an artist, but that's the left hand. And over here is your left lung. So the left lung is going to receive the left pulmonary artery, and the left pulmonary artery is high in CO2. pulmonary artery becomes the pulmonary arteriole. And then there's these beautiful tiny little vessels in which only one red blood cell can move through at one time, tiny, tiny microscopic capillaries. And they are called exchange vessels, air quotes, exchange vessels. Forever remember them as that, because at the lung level, there's these air sacs called alveoli, so that CO2 is picked up by a diffusion because there's a higher concentration of CO2 in the capillaries and a lower concentration of CO2 in the lungs. So CO2 naturally via diffusion goes from a higher concentration to a lower concentration, down the concentration gradient and into the alveoli, and on expiration, you get rid of the CO2. But what else is in the alveoli? Oxygen. So there's a higher level of oxygen in the lungs, but a lower level of oxygen in those capillaries. So guess what? The capillaries pick up by gas diffusion, the oxygen, and then how does it get transported to this beautiful left side of the heart that has such a big job to pump the blood to the rest of the body? Well, you've got these pulmonary veins, which I'm going to clear all this hot mess. These are the pulmonary veins. All right. So let's circle back to what we talked about. The pulmonary arteries, there's only one going to the left lung and one going to the right lung, right? Now, that's deoxygenated blood going to the lungs. But coming back from the lungs, right, you've got two from the left and two from the right feeding into that left atrium. So this is the left side, right? So left lung over here, pretend this is a lung, and this is the right lung. All right. So we've got oxygenated blood returning via the pulmonary veins. And unlike the pulmonary arteries, we have two pulmonary veins from the right lung and two pulmonary veins from the left lung. LPV times 2, right pulmonary, did I say LPL? LPV, left pulmonary vein and right pulmonary vein, times 2, okay? Times 1 only here for right and left pulmonary artery. Okay, so we just explained in a quick 5 minutes the great vessels and the chambers. And now all that's left is, well, the heart is a huge pump and it has a lot of muscle. It has cardiac muscle, which is striated. It is involuntary. It has intercalated discs so that all the muscles in tandem contract together, so that the chambers contract together. Right and left atrium contract together. Right and left ventricles contract together. So in order for that to happen, you've got to bring oxygen to these muscles. And so we have these arteries. These are called the coronary arteries. And we have veins that drain deoxygenated blood from the cardiac muscle tissue. We have a left coronary and a right coronary. I'm not going to go into details because right now I'm just trying to get you to understand the blood flow through the heart. All right, but suffice to say, the left coronary artery is what we traditionally call the widowmaker, because it really is super important to get oxygenated blood to that left side of the heart so that it can do its thing, right? Pump and send more oxygenated blood throughout the rest of the body. All right, so I'm done with this slide finally, and this labels it all out for you. So let's go over it. The aortic arch, as you know, is going to deliver oxygenated blood to all parts of the body via the thoracic aorta, abdominal aorta, and then all throughout the rest of the body. Now, it has 3 divisions here that's going to feed oxygenated blood to the neck and head. So you got the brachiocephalic trunk, the left common carotid artery, and the left subclavian that you can see here. Again, to review, you've got the superior and inferior vena cava feeding into the right side of the heart, right atrium, right ventricle. And then the right ventricle, when it contracts, it forces a valve open, the pulmonary valve, and that blood is pumped into the pulmonary trunk. And remember, times 1, we only have one pulmonary artery to the left and one pulmonary artery to the right lung going there, deoxygenated blood, gas exchange at the capillary level where the alveoli are providing the oxygen and the capillaries gas diffusion of CO2 to the alveoli to be exhaled later. Now we've got the capillaries that are filled with oxygen feeding into the venules, little tiny veins. Venules eventually feed into the two main pipelines, the right pulmonary vein, two from the right lung, and two pulmonary veins from the left lung. So here they are. I'm going to draw them in red. Pulmonary veins. And now we're going through the left atrium, left ventricle, and then it's all going to be pumped out into the aorta, some to the head, neck, right? And then the rest is going to go out throughout the rest of the body. Now, what else do you see here? Well, you can see the coronary arteries. So let's go over and take a look at this right coronary artery, just inferior to the right auricle. And inside the right auricle is the right atrium. So not written out there, but inside is the right atrium. Okay, so this right coronary is going to feed this whole right side of the heart because it also has other branches, which I'm going to keep it simple today. There's a right marginal, and there's, the anterior interventricular artery coming off of the left coronary, and there's a circumflex, and then eventually they go around the back. And so the whole heart is getting fed oxygenated blood. If there is a clot or a plaque formation, this stops temporarily or permanently the heart. Well, temporarily it can, the plaque formation is going to cut off oxygen, and some muscle can die, and that's what a myocardial infarction is, a heart attack. And if this continues onward, the heart will permanently die. And then obviously multi-system organ failure, and eventually brain death and death. All right, now if we do a sagittal cut of the heart, this is what we see on the inside. So let's go over the structures. The superior inferior vena cava again. Here's the right atrium, and here's the left atrium. Here's the right ventricle, here's the left ventricle. What do you see that's super important to note? I'm going to show it to you. You see a very thick myocardium in the left ventricle versus a much thinner one in the right ventricle. Why is that? Because the right ventricle only has to pump hard enough to the pulmonary trunk and pulmonary arteries to the lungs. The pulmonary circuit is much shorter, whereas the left ventricle has to do a big job of pumping blood to the aorta throughout the rest of the body and to the head and neck. Okay, so that's a big difference. And remember, we divide the left and the right side into two double pumps. As the blood enters the right atrium, blood is also entering the left atrium simultaneously. During the resting phase, because there's the systolic phase and the diastolic phase. The diastolic phase, we call it the filling phase. That's when the blood is starting to fill inside the heart. The systolic phase is when the heart is actually pumping and working. All right, so let's go over it. So now that we learned that things are happening simultaneously, I need to show you the valves that keep things organized. Why? Because during the diastolic phase, is the blood filling phase, these valves here, these are called the atrioventricular valves. Together, they're called the atrioventricular valves. But separately, on the right side, this is called the tricuspid valve. How do you remember tri? Tri-ri, right side. Okay, that's how I learned it in school, so maybe that'll help you. Tri-ri, right side. Tricuspid is the right side of the heart. The bicuspid is the left side of the heart, but guess what? We had to be different. In the medical world, we say mitral valve, okay? Why is it anatomically called bicuspid? Because literally it's two cusps like this, whereas a tricuspid has three cusps, and so it looks different. Okay, these valves, during the filling phase, the diastolic phase, these valves are completely open, And so blood enters the left and the right side simultaneously during this diastolic phase. So let's go over it. During the diastole phase, blood is returning to the right side of the heart via superior and inferior vena cava, filling into the right atrium and the right ventricle because the tricuspid valve is open. 80% of this blood is entering, just naturally flowing in. There's no contraction, nothing is pumping here. Just blood is flowing naturally through the superior and inferior vena cava into the right atrium and right ventricle because who's open? Tricuspid valve is open. Simultaneously, at the same time, we've got blood flowing coming from the left pulmonary veins and the right pulmonary veins, 2 from the left, 2 from the right. So 2 pulmonary veins from the right lung, 2 pulmonary veins from the left lung entering the left atrium, and that blood that's oxygenated flows into the left ventricle. Why does it flow easily, 80% of it as well? Because the mitral valve is open. And then what? Well, once enough blood has filled the ventricle, we are entering the phase where the atria, meaning the right and the left atrium, is going to go into the cycle of contraction. But in order for that to happen, it's an electrochemical event where we have these nodes that we're going to talk about later that get activated and activate. It's a neuromuscular event and activate the cardiac muscle to contract. So these nodes are electrical signals, and so the atria will contract. When the atria, both left and right, contract, the remaining 20% of blood must be pumped into the ventricles. Both simultaneously, the blood is pumped into the ventricles. During this time, this is atrial contraction on an EKG. You see it very clearly, which is the P wave. And then atrial contraction is complete. You have a flat on an EKG, a flat line. That's when atrial contraction is complete. And we're getting ready now to cause depolarization. And the electrical signal goes down the interventricular septum and up the ventricular walls to the Purkinje fibers, which we're going to go over in a minute. And that activates the ventricles to contract. Now, before all that happens, all 100% of the blood is now inside the ventricles. And so this is the point where the tricuspid and the mitral or bicuspid need to close. And that's called S1. And that's the first heart sound. The ba-bum, 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 ba-bum. The first heart sound, the pa of the pa-bum, is the closure of the atrioventricular valves. S1 is the heart valves closing, okay? The AV valves closing, atrioventricular valves closing. Remember what I said, who are the AV valves? The tricuspid and the mitral, otherwise known as bicuspid, okay? So once the S1 happens, the next phase is that you've got the ventricular contraction. You've got 100% of the blood in there. That blood is pushing those valves closed and maintaining it closed if the valves are functional, right? And so that interventricular pressure rises and forces another set of valves open. Now we're going to go over those valves. We have a valve that's visible to us in this diagram. And that valve here is called the pulmonary valve. And then another valve, which I'm not sure if you can see very well, I'm going to color it, circle it right here. And it kind of looks like 2 little buns. And that would be the aortic valves. All right. So we got the pulmonary valves and the aortic valves right here. 1, 2. Now it's like a crisscross happening. So when the ventricles are contracting, there's a strong ejection fraction if the heart is working properly, and it forces the pulmonary valve and aortic valve open, and all that blood goes swoosh, ventricular contraction, and pushes the blood into the great vessels. So on the right side, the right ventricle contracts and ejects the blood and forces the pulmonary valve open and ejects the blood into the pulmonary trunk. And that's the right side. And on the left side, the left ventricle contracts and forces the aortic valve open and pushes that blood into the aortic arch. Now, the next event, you don't want that blood backflowing into the ventricles. You want it going away. You want the pulmonary trunk to take that blood to the pulmonary arteries and to the lungs so that the deoxygenated blood could get reoxygenated. And on the same token, on the left side, you want that aortic arch to send that blood, keep it going to the aorta and not backflow back into that left ventricle. So guess what? The second heart sound happens, and that's S2. We call that S2, second heart sound, and that is the closure of the semilunar valves. Semilunar valves, because they look like half moons, are the aortic and pulmonary valves. All right, so S2, second heart sound. And it is closure of semilunar valves. And remember what the semilunar valves are: the aortic valve and the pulmonary valve, okay? The atrioventricular valves are the tricuspid and the bicuspid. So key structures here that you need to practice and make sure you understand. So here's the right atrium for A. So there's nothing labeled here, but that would be the left atrium. This is the tricuspid valve, and this is the bicuspid, also known as mitral valve. Now, I need to show you something else. These structures that are not labeled here, they look like little guitar strings. Chordae tendineae, right there. Chordae tendineae. I think I spelled it right. And then these structures that look like finger-like projections are called papillary muscle. And you can see it here as well, auto-generated. I'm glad that it works pretty well as I'm speaking. It's spelling it pretty nicely. All right, what else do I want to show you here? So D is mitral. B is tricuspid. A is right atrium. All right, now C, as you can see, it's pointing to two vessels. Well, where do you have two? Two from the right lung, two from the left lung, returning oxygenated blood right here. So those are the pulmonary veins, okay? So two from the right, two from the left, bringing oxygenated blood. Two from the right, two from the left, coming from the lungs, pulmonary veins. I know I'm repetitive, but this is how you remember it, okay? Only one to the left and one to the right. Those are the pulmonary arteries delivering the oxygenated blood to the lungs. That would be this one, pulmonary artery going to the left lung, if this was the left lung here. And this one is right pulmonary artery going to the right lung. All right, so what would this be? Well, this is the pulmonary trunk, so this is the pulmonary valve right here. This is the aortic arch. And so over here would be the aortic valve. All right, so that's everything. Now let's take a look at the posterior view of the heart so you can really access all the structures and commit it to memory. This is the view from the back. It looks very different. As you can see here, the two pulmonary veins coming from the left lung, so left pulmonary veins, and then the two pulmonary veins coming from the right lung, so right pulmonary veins. And here you only have one. So I think I beat that to the ground, but you can see it much better from a posterior view. The left pulmonary artery and the right pulmonary artery. And here's the aortic arch. Here's the superior vena cava. And notice that the inferior vena cava, it's actually coming up like this. And then you're going to see it coming straight at you. If it was three-dimensional, that it curves. Naturally in the body, it's going to come straight up, ascending up proximally, posteriorly, and then coming straight into feeding into that right atrium. Now, if you want to identify a posterior versus an anterior view, it's easy. The apex on the anterior view on an image is always going to be facing the patient's left, and then the apex on the posterior view is going to be still facing the patient's left, but you're looking at it from the back posterior view, you see? So you got to think like what it would be like in situ, okay, in the body, the way it is. What else did I want to show you? Posterior view, you're going to see the coronary sinus. This is a major vein that drains all the deoxygenated blood from the tissue of the heart. Remember, the oxygen is needed by the muscle tissue of the heart. So in order for the heart to pump oxygenated blood and deoxygenated blood, it needs oxygenated blood, and that's the coronary arteries. And then, of course, when you've got buildup of carbon dioxide, the coronary sinus is going to pick up all that deoxygenated blood from its tributaries, like the posterior vein of the left ventricle and the middle cardiac vein, etc. All right, so what are the structures involved in the cardiovascular system? Just because you learn the heart doesn't mean that it's all of it. You need to understand how it delivers, who delivers the deoxygenated blood to the lungs, and that would be the pulmonary arteries. And then who delivers the oxygenated blood from the lungs to the heart? That would be 2 pulmonary veins from the left lung and 2 pulmonary veins from the right lung. And what do the pulmonary veins and arteries, how do they differ than the systemic veins and arteries? And I think I started to talk about that at the beginning of this lecture, that systemic arteries are oxygenated blood delivering it from the heart to the rest of the body. And the veins that are systemic are delivering deoxygenated blood back to the heart. Whereas pulmonary, it's reverse. Pulmonary artery delivers blood away from the heart to the lungs, and it's deoxygenated blood. Whereas pulmonary veins, it's delivering blood to the heart and it's oxygenated, unlike the systemic veins, which delivers deoxygenated blood to the heart. Hopefully that's not too confusing, but you really need to understand that concept. And understand that the capillary network is super important because they are the mediators where we're like, what are we doing here? At the lung level, we're exchanging oxygen and carbon dioxide. At the cellular level, not to mention all the tissues throughout all parts of the body, every single cell is going to deliver the CO2 to the capillary, and the capillary is going to pick up this CO2, right? So it's amazing. The capillary is an exchange vessel, and even at the tissue level, we're delivering the oxygen to the cells, and simultaneously, because of the partial pressure gradient, the CO2 buildup in the cell, it's going to move across via diffusion from the cell to the capillary, since it's just a natural progression from higher concentration to lower concentration down that concentration gradient. And that's the capillary network and what it does for you across all structures. So as you can see here in this image, you've got the deoxygenated blood, right side of the heart, going to the lungs. CO2 is exchanged for O2. Oxygenated blood entering the left atrium via the pulmonary veins. Oxygenated blood traveling from the aortic arch to the aorta to head and neck via the carotids, right? Common carotid. And then the heart is going to pump the blood throughout all parts of the body systemically. And when you get to the capillary level, you're delivering O2 to the cells, and the cells are going to deliver the CO2 to the capillaries via gas diffusion. And then the tiny little venules eventually feed into larger veins like the iliac vein, the renal vein, hepatic portal vein. All these veins are all going to feed into the inferior vena cava, which delivers it to the right side of the heart. Same thing goes for the head and neck and arms, where CO2 is picked up by the capillary network in the head and arms. And so CO2 buildup and the deoxygenated blood is returning to the right side of the heart via superior vena cava, entering the right atrium. Boom. There it is. So understand the difference between systemic and pulmonary. So veins carries oxygen poor blood back to the heart systemically. The function is to move deoxygenated blood back to the heart. The exception in pulmonary circulation, the pulmonary veins, 2 from the left, 2 from the right lung, are carrying oxygenated blood back to the left atrium. Arteries systemically carries oxygen-rich blood away from the heart, function to deliver nutrients and oxygen through blood to all cells in the body, reaching every tissue via its branches. Exception, again, pulmonary circulation. You've got pulmonary arteries. One vessel goes to the right lung, the other vessel to the left lung, carrying deoxygenated blood to the lungs. So the location of the heart is mid-sternal area between the right and left lungs. It has involuntary striated muscle working together, cardiac muscle. When they work together as a syncytium, it is due to the intercalated discs cellularly that causes kind of a unification of muscle contraction. The atria contract to eject the blood into the ventricles, and that is also something that we're going to talk about very soon regarding the electrochemical event. Ventricles also contract in unison to pump the blood out into the outgoing vessels on the right side to the pulmonary trunk, on the left side to the aortic arch. And I think I beat this to the ground, so I'm pretty sure you get that now. And so if we look at the lungs and where they are, this is the beating heart. You can take a look and really enjoy this view and understand that the heart and lungs are so orchestrated and working properly together. If one loses its function, so does the other. So they are very much dependent on each other. All right. The lungs' role in the cardiovascular system, although minimal, it is vital in adding the oxygen to the bloodstream. So the pulmonary artery, again, to revisit and circle back, carries deoxygenated blood to the lungs, while the pulmonary veins, 2 from the left, 2 from the right lung, carry oxygenated blood from the lungs to the left side of the heart, entering the left atrium, left ventricle, and then eventually the aorta. So if any of you want this layout of how I wrote it down, I'm not going to read this to you because I've already read it to you. But if you want this PowerPoint, just reach out to me and I'll send it to you privately. I can't seem to send it in the announcements section of Canvas. All right, so what I'm going to do is just kind of go over it without reading it, because this is how I want you to learn it. I want you to be so good at this that you can just explain it to me like just conversation style, like I am now. All right, so here we go. Here's the blood flow through the heart. And then when I finish this PowerPoint, you're going to be shocked because we're going to even add another layer to it, the EKG and the electroconductivity of the heart. So we're getting to that. I'm building up layer by layer. All right, here's how the blood flow through the heart goes. So after the systolic phase, we enter the diastolic filling phase. And so this is when the blood is naturally flowing back into the heart. So on the left side, we've got the inferior vena cava delivering deoxygenated blood from the lower extremity into the right atrium, and on the right side of the heart. Now, the superior vena cava is delivering deoxygenated blood from the head, neck, and superior limb back into that right atrium. Simultaneously, we've got blood flowing into the left atrium as well. And this is the oxygenated blood returning from the lungs, freshly oxygenated blood returning via 2 pulmonary veins from the left lung, returning that oxygenated blood, and 2 pulmonary veins from the right lung, returning oxygenated blood into the right atrium. Now, Both the right and the left atrioventricular valves, on the right side tricuspid, on the left side mitral, are completely open. The valves are open. 80% of the blood is flowing freely from the atria, both right and left atrium, into both right and left ventricle. Now, a series of events occurs, depolarization and the conductivity from the sinoatrial node to the AV node, which leads to the atria contracting. The atria contracts and now pumps the remaining 20% of the blood into the ventricles. And once this happens, the atrioventricular valves close. This is S1, or the first heart sound. 100% of the blood is now in the ventricles, and the valves remain closed because the blood is holding the cusps closed. And if the valves are working, the atrioventricular valves are working, all the blood remains in the ventricles and there's no backflow in the atria. That would be disease, valvular disease. Side note. All right, now it's come time to have ventricular contraction. But before that can happen, we have to revisit what happened before, where the SA node was activated through an electrochemical event, which is then sent to the AV node, atrioventricular node, and then it comes down the interventricular septum and up these Purkinje fibers, which activate the ventricular muscles to contract. Great, ventricular contraction occurs, forceful ventricular contraction occurs, and it forces the semilunar valves open. On the right side, it's the pulmonary valve. On the left side, it's the aortic valve. They're both at the same time forced open, and boom, we've got ventricular ejection. On the right ventricle, we've got blood pumped into the pulmonary trunk. Simultaneously, the left ventricle is pumping the blood into the aortic arch. Now there's closure of the semilunar valves. That's S2, second heart sound. So boom, the second heart sound, and that prevents the backflow of blood back into the ventricles. Instead, the blood is now moving from the pulmonary trunk to right and left pulmonary artery to the lungs for reoxygenation. And the blood in the aortic arch is going to be delivered via the aorta. And, if it's head and neck, it's going to be delivered via the common carotid to the head and neck. And so the aorta is going to deliver the oxygenated blood throughout the rest of the body via all its arterial branches coming off the aorta. And that there is the blood flow through the heart. And this is repeated until the day you die. All right, hope you enjoy that. So this shows you, let me move this over. As the blood enters the atria and the ventricles, the AV valves remain open. The relaxation phase is called diastole, which is what I described before. 80% of the blood flows into the chambers this way. Simultaneous blood flow into both atria and ventricles. This occurs naturally during diastole. 80% of that blood flows like that. The remaining 20% is only going to happen if the atria contract. So in order for the atria to contract, that is the beginning of the systolic phase or the contraction phase, because systole is not just contraction of the atria, it's also a segment in time of the cardiac cycle that includes atrial and ventricular contraction. All right, so the atria contract, simultaneously pumping the remaining 20% of the blood into the ventricles. Both the tricuspid and bicuspid or mitral valve are now closed. 100% of the blood is in the ventricles. And the closure of the AV valves represent S1, the lub of the lub-dub sound. And so here you can see that the contraction, you can see the atria are smaller chambers now, contracting and pushing the blood 100% into the ventricles. All right. And then the valves are closed. Once the ventricular contraction occurs, you can see the contraction. I don't know if you can see that this is in relaxation. The ventricles are relaxed, and here the ventricles are contracting. The ventricles contract, forcing the blood against the AV cusps, so atrioventricular cusps. And so that ensures that the atrioventricular valves remain closed. The papillary muscles, the finger-like projections, are going to pull on the chordae tendinate to make sure that the valve stays closed. And the next phase is the complete ventricular contraction, forcing the semilunar valves open, and that's what's seen in this image. The pulmonary valve and the aortic valve is forced open, and you can see the arrows because it's happening simultaneously like this, where you've got the pulmonary trunk receiving that blood and the aortic arch receiving that blood, and blood going everywhere, right? To all the tributaries going to the head and neck, and to the aorta through all the tributaries going to the rest of the body. So as the ventricles contract, the interventricular pressure rises so much that it pushes the semilunar valves, forcing them open, and that's how it happens. And then if the valves are working properly, you see these semilunar valves, they look like little cusps, kind of like if you put the palms together and you want to hold the water in your hands and you don't want to spill it. It's kind of like that when it's closed, so that the blood doesn't go backwards. You don't want backflow into the ventricles. So the blood is pumped out of the ventricles and into the pulmonary trunk and aortic arch, forcing these semilunar valves open. As the ventricular pressure drops, the blood slightly falls back from the arteries, forcing the semilunar valves closed, causing the second heart sound. That little tiny backflow is going to be like, oh, okay, hold on, we got to close. And so when they're closed, that's the second heart sound. And now, last but not least, we got to talk about the cardiac impulse and how that relates to an EKG. So the cardiac impulse in the end is what makes it all happen. You can't pump that blood unless the muscle works, and you can't make that muscle work unless we have nervous tissue, excitable tissue that activates the muscle. So we have the sinus node that's really pretty much controlled by the vagus nerve at a regular rate and rhythm. And we have the AV node, which splits up into the right and left bundle branch, which then further breaks up into the Purkinje fibers. So the electrical signal goes from the SA node to the AV node. That causes atrial contraction. And then from the AV node down the bundle branches into the Purkinje fibers, that causes the initiation of the ventricular muscles to initiate ventricular contraction. So the cardiac cycle is the SA node, which is basically your pacemaker of the heart. It is the pilot. The co-pilot is the AV node. And so if you have the SA node working, great. If you don't, guess what? The AV node takes over, but your heart rate significantly goes down. So the AV node is stimulated and carries the impulse to the AV node, which initiates depolarization and final atrial contraction. This then leads to the S1 heart sound, closure of the atrioventricular valves. And now all that blood is in the ventricles, but it can't stay there. So therefore, the electrical impulse continues down the AV bundle to the bundle branches and the Purkinje fibers to initiate ventricular contraction. Once ventricular contraction occurs, then there's the closure of the AV valves because the blood is now outside of the ventricles in the aorta, aortic arch, and the pulmonary trunk on the right side. So that forces the closure, because if there's any blood that's going backwards, it's going to close the aortic and semilunar valves, and that's the second heart sound. So always remember that these nodes and bundles send and conduct electrochemical impulses, which I don't want to, that's a whole other lecture of, the sodium, the potassium, the calcium, all of these electrolytes that activate depolarization and initiate the muscle tissue to contract. So the nervous system control is really going to come to the aspect of understanding the nervous system as well. Fight or flight is sympathetic, parasympathetic is rest and digest and maintain a regular resting heart rate. And so that's coming from the medulla oblongata, which is the lower part of your brain. And you've got the midbrain, pons, and medulla. And so the medulla itself has these nuclei, which are clusters of neurons that control the heart rate. And so there's the sympathetic that is going to turn on the SA node to increase your heart rate, and then the cardio inhibitory, turn off and maintain, turning off is to maintain the resting heart rate. Now, how does this relate to an EKG, and why do we always do an EKG when someone has issues with their heart? Well, we want to understand and know if the process is happening correctly. Are the atria contracting together? Is there a problem with backflow? Is the atria and the ventricles just like quivering and not really pumping at all? That's a heart attack. And you're going to see ST elevation, ST segment elevation, or maybe even an inverted T wave. These are all things that you're going to learn once you understand the heart. So first, we're going to understand what a normal EKG looks like and relate it to what we just described, the blood flow and the cardiac cycle. So the atrial depolarization event is all thanks to the SA node and the AV node. And you can see that on an EKG as the P wave. We call that the P to Q interval. Once atrial depolarization is complete, atrial contraction occurs, and the flat line is the pause where the signal goes down into the bundle branches and Purkinje fibers, and then initiates depolarization of the ventricles. All right, so this ventricular depolarization is the main event, the QRS. The P wave is atrial depolarization. The QRS is ventricular depolarization. Simultaneously, I must add that while the ventricles are depolarizing, the atria are going back to its original resting membrane potential. So that's called atrial repolarization, but that's not mentioned very much. But I do want to add that to be complete for the sake of completion. All right, so P is the atrial depolarization event. All right, the flat line is atrial depolarization is complete. All right, and that's the time when we've got the contraction and pumping the blood into that 20% of the blood is pumped into the ventricles, right? And now that cardiac impulse travels further down the bundle branches and Purkinje fibers, causing depolarization of the ventricles, and that's the QRS. That leads to ventricular contraction. And when depolarization is complete, this is the ST segment. And now we've got that whole process of the ventricles pumping and releasing the blood, forcing the semilunar valves open, and the blood is now in the aortic and pulmonary vessels, right? You've got the pulmonary trunk, pulmonary artery, and aortic arch and aorta. So all of that is occurring. The S2 heart sound is a closure of the semilunar valves. And then finally, once this ventricular depolarization is complete and all that jazz happened, all that stuff, we pump the blood out of the ventricles, and now the blood is in the aortic arch and the pulmonary trunk, and there's a little backflow and the valves close. That's the S2 heart sound. Great. Now what? Well, during that process already, while that's happening, the ventricles are repolarizing, and that's what the T wave is all about. A lot happening simultaneously. So with that said, I'm putting it all together finally, and we've got the SA node that is causing depolarization of the atria, P wave. And so atrial depolarization, as you know, is initiated by the SA node. It causes that P wave, and then it further is going to initiate the remainder of the atria to depolarize because it reaches the AV node. Once it reaches the AV node, atrial depolarization is complete, and that's the flat line here. With atrial depolarization complete, the impulse is delayed at the AV node. Why is the AV node? There's a little bit of a delay because we need to allow for the contraction and pumping of that remaining 20% of the blood into the ventricles before we close the atrioventricular valves, right? We need all that blood to ensure that 100% of the blood is in the ventricles before we initiate the further depolarization. We don't want to start the ventricles to pump out the blood before we get all the blood in there, right? So that's the pause. Okay, now what? Now that the AV node had a little bit of a slight delay and all the blood is in the ventricles, it is time for the interventricular septum muscles to depolarize. Okay, and so that's happening, and the ventricles are starting to depolarize. So this is ventricular depolarization begins, and it causes the QRS complex. And once that happens, the ventricles are all depolarized. Immediate ventricular contraction occurs. The blood is pumped because it forces the semilunar valves open. So now the blood is in the pulmonary trunk on the right side and the aortic arch on the left side. The second heart sound occurs and ventricular depolarization is complete. That's the flat line here. And once that second heart sound occurs, we're going to move into the process of diastole again. So we need to repolarize. So while the blood is pumped out of the ventricles and S2 heart sound occurs and the semilunar valves are closed, we enter this phase, the T wave phase. And this T wave phase is repolarization of the ventricles back to that resting membrane potential. And once ventricular repolarization is complete, then we go back to the filling phase, diastole, where 80% of the blood flows in. And this nothing's happening for a little while, right? The SA node is relaxed just for a bit till we get 80% of that blood flowing in through the atria and the ventricles. And the cycle continues to repeat itself. So here I'm going to separate it out segment by segment, play by play. So we revisit and circle back so you can really reinforce this concept. So the SA node fires, the atrial depolarization occurs, and we've got the P wave. Okay, there it is. Second occurrence is that the P wave represented the SA node reaching the AV node. So once it reaches the AV node, atrial depolarization is complete. With atrial depolarization complete, this is the flat line here. Okay, the flat line after the P wave. And this represents the delay in that AV node firing. So the impulse is delayed at the AV node. Next. Third occurrence is now it's no longer delayed and the impulse travels down the interventricular septum and into the ventricles, ventricular wall, and all the muscles are stimulated by this depolarization. So ventricular depolarization, and it's seen on an EKG as a QRS. And so that is the QRS complex. But note, do you see the red here? The red represents repolarization. So while the ventricles are depolarizing, simultaneously the atria are repolarizing. So make sure you understand that concept. All right, so let me draw that out. So here we've got repo, and not to be confused with repossession, and then depot, so depolarization. Okay, simultaneously, and that represents the QRS. Okay, and then the T wave is repolarization. We're going to look at that next. Here we go. So once ventricular depolarization is complete, all right, ventricular depolarization is complete. Now is the phase where the blood is pumped out and it's reaching on the right side the pulmonary trunk, on the left side the aortic arch. And now we're about to hear the S2 sound where the semilunar valves close. And guess what? We're going to enter the repolarization of the ventricles, which is right here, repolarization. So repolarization is seen in red. So you've got ventricular depolarization complete. That's the flat line. So when you see a flat line, something's complete, there's a pause. And what's the pause here? It's the process of the blood getting pumped out and hearing the second heart sound. And then once that's happened and, you know, the valves are already closed, the T wave is repolarized, is a representation of repolarization of the ventricles. All right, so once the ventricular repolarization is complete, Now we go back to the filling phase and we repeat the cycle. All right, and here's a summary. PQRS. And then here's the segment of pause in between the T. So remember, what are the pauses? All right, here's atrial depolarization complete. All right, and then here, ventricular depolarization complete. Here, atrial depolarization complete. Here, ventricular depolarization complete. Okay. And this is the T wave, represents ventricular repolarization beginning and ventricular repolarization complete. All right, so that was a very long session. And I do hope that you enjoyed this lesson. And please feel free to reach out to me if you have any questions. I do hope that this helped. Bye.